Hey crew, this is Dr. Mike,
And Dr. Ben Bagge.
and this is episode number 1 of the Active Oakland podcast. First of all, we just wanted to say thank you guys for listening, especially if you guys are one of our current or past clients. Thank you for your loyalty and sticking around with us. And if you haven't ever worked with us or you're new to Pro Kinetix, we want to welcome you to the podcast. And thank you for taking the time out of your day to listen to our podcast. So before we dive into this show, we want to make sure that this podcast is a good fit for whoever's listening. The purpose of this podcast is we want to work with people that are really serious about their health and wellness, and that make it a really big pride in their life. So we're going to be diving really deep into health and fitness topics. We're going to be focusing mainly on 4 pillars of health. These pillars include first, movement; second, nutrition; third, stress; and fourth, sleep. So we're going to be diving deep. We're going to be working and interviewing local experts in the community, kind of getting their expertise and sharing that expertise with us. So yeah, we're going to be diving deep in those topics. So we want to make sure that whoever is listening, that they are committed and serious about their health. But also on top of that, probably are wondering who we are. So let's dive into a little background information about us.
So my name is Dr. Ben Bagge, and like Mike, I also have my doctorate in physical therapy, and I'm also a certified strength and conditioning specialist. And I was born and raised in the middle of nowhere in Iowa. And as physical therapists and strength and conditioning specialists, we're huge advocates of movement and exercise and maintaining a lifestyle. That allows you to stay active no matter what your age. And that's what I'm really passionate about. Then yeah, Mike, I'll let you kind of introduce yourself as well before we move on.
Yeah. Just as Dr. Bagge is as well, I'm a physical therapist and certified strength and conditioning specialist. We're both small town boys. I'm from Montana. I have a background in coaching. So before I started physical therapy school, I worked as a powerlifting coach up in Montana. I have an expansive background in sports. I've played sports ranging from football, hockey, soccer, baseball, basketball, swimming, karate. So really when I was younger, I just fell in love and ended up being kind of obsessed with sports, kind of fell in love with human movement, and ended up going down the path of physical therapy because of my love for sports, exercise, fitness, and I felt like that field kind of coincided really well with my passions and interests. And I find that, for me personally, how fulfilling and how much of those aspects of my life are important to my physical, but also mental well-being. So I find great fulfillment, enjoyment, getting to work with and help people get back to the things they love, getting active, being able to maintain and work on their fitness, and encouraging them and guiding them in that process.
Yeah, that's awesome. And like Mike said, we're going to touch on those four pillars of health, but we're utilizing this podcast as a way to for our listeners to get to know other reputable health practitioners, gym owners in the area, or local experts on health and fitness. Come on and join us so we can talk about a large range of topics such as sleep, stress, movement, nutrition, running, and also touching on some common injuries that we see as well, and helping you guys guide you in those areas.
Yeah, so to elaborate on that, and as I spoke about earlier, with those interviews and with those extras we're going to talk about, we are going to try to focus on those 4 main pillars. So I kind of want to dive back into those, give a little more, elaborate on those a little bit. So the first one is movement. Really all of us, like, we should, and our body is designed to last. Our joints, our bodies are built to last 100 years. But I'm sure many of you have found that they've had times, or you've had times where maybe it's hard to get off the ground, or maybe you've had an injury and you've been one of those people, or you've heard about those people that have said, oh, I hurt my knees, or I tweaked my back deadlifting, and they ended up stop exercising or stop lifting, when really our bodies are really robust. We're designed to move. It's essential for health and wellness. So movement is going to be a huge pillar and priority in our lives. and we'll be digging deeper into that as well. And then stress, of course, we all, as Oaklanders and San Franciscans, that deal with a lot of stress, as you all know, in the Bay Area. It's a very busy and hectic area. Everyone's really focused on, working hard, career focused. But I think oftentimes many of us don't really have strategies to manage that. And stress has been shown time and time again to be deleterious to our health and our wellness. So we're going to be coming up hopefully with some really practical strategies and takeaways for us to have ways to manage that stress. And third is nutrition. So you've heard it 1,000 times, we are what we eat. But I think what can get hard with that is there's so many different diets out there, so much a variety of and often contradicting information out there. So we're going to hopefully distill it down again to just some basic principles, things that are practical takeaways, and hopefully kind of clear all that clutter about what diet's kind of best, and make it into more of a simplified, practical way to manage your diet. And fourth, and certainly not least, is sleep. I don't know about you, but I think many of us find that there's at least periods in our lives where we are not getting adequate sleep. You've all heard that's recommended to get 7 to 9 hours of sleep, but statistics show that there's 50 to 70 million Americans in the US that are not getting enough sleep. And I oftentimes have fallen into that category. And the statistics and the research is really consistent with showing that when we are lacking sleep, it does affect our mental health. It does affect negative implications in terms of cancer, our immune system, our hormone system. So really, we end up just shooting ourselves in the foot, being less productive if we end up not getting that adequate amount of sleep. So we'll be hopefully diving into the health benefits of that, and then again, ways that we can figure out how to better manage our sleep.
Yeah, and then one thing I forgot to mention earlier in the podcast too is, if any of our listeners know of anybody that would be an awesome guest for our podcast and kind of fit with our mission, we would love to, learn a bit more about them. And you can send their information to admin@prokinetixrehab.com, because we're going to probably do this podcast once a month or something like that, once every 3 weeks. And each week we want to bring on a new local expert on a large range of these topics. One other goal that we have with this podcast is to give you guys not just our opinions, but what the research is showing based on sleep, nutrition, exercise, injury prevention, treatment of injuries. This isn't going to be just our opinions. Everything that we're going to be giving you is based on research. What does the best research out there say, right? Because that's the highest level of evidence. And like Mike said, is, our body is meant to last a lifetime. We want to be giving you guys natural solutions, lifestyle changes, and different choices that you guys can make to allow your body to last a lifetime. Don't get me wrong, there are instances where, surgical interventions needed, but most of the time, a lot of things can be corrected by doing physical therapy, chiropractic, acupuncture, massage, and exercise, and changing our diets, changing our sleep. That can make a huge difference with and then allowing us to also avoid surgery. I'm sure, Mike, you've got tons of examples of different or past patients that you saved from surgery and whatnot too. So I don't know if you want to talk about any of those stories, because I know you told me one the other day, and it was super powerful, and I think it'd be really beneficial for our listeners to hear that as well.
No, yeah, no, man, no, for sure. I love telling this story. It always it's encouraging to me, and I hope it is encouraging to you guys as well. I had a patient last year. She was a really active person. She used to be a snowmobile guide. She was really into her health and fitness. But kind of one of these days, she ended up just having a weird back tweak where she was trying to move her snowmobile, ended up just getting this weird spasm in her back, shot down her foot. She's like, uh-oh, messed something up. And, it was hard for her even to get up after that incident. So obviously concerned, she went and saw her medical provider. She kind of was taken through the whole system and just given the normal spiel that, yeah, you jacked up your back, the discs are all messed up, you look like you have the spine of an 8-year-old. The only way out of this is going to be surgery. Otherwise, we can't guarantee that you'll ever be out of pain unless you go under the knife. And obviously that's kind of a scary thing to hear and something that's pretty discouraging. So she wanted to get a second opinion, saw another doctor, same story. And then her physician assistant is saying, yeah, if you, we'd like to get you scheduled for surgery. And she wanted to know if she had other options. And they said, well, I mean, before the surgery, if you want, you could, if you so desire, maybe see a physical therapist. Maybe they can at least get you out of some pain. But again, your back is jacked up. It's going to need surgical intervention. So she ended up seeing us. And we just took her through the typical rehab process and ended up, first day she was in still so much pain that she had difficulty and was very scared to even pick up a 5-pound weight. But we started off really slow, progressed her rehab, and in about a 10-week period, we had her initially starting with that 5-pound weight all the way to deadlifting, like on a bar, 225 pounds, and without pain as well, of course. So she ended up, calling off the surgery clearly. She's actually now really into powerlifting. So kind of a 180. I saw her, her complete confidence and that effect that, going through that rehab process and seeing again that her body is resilient and strong, and that, as Ben said, sometimes surgery is necessary, but there are other options as well before you have to go on the knife. So, yeah.
Yeah, I mean, Mike, that's such like an awesome story. And I think a lot of patients are just, they don't understand the capabilities that their bodies have and how strong and resilient they actually are. People really think that their bodies are delicate, but it couldn't be further from the truth. And that kind of leads me into a similar patient. She was having pain with running. She was 26 years old, and she had been a previous runner and started developing some knee pain. And this has gone on for about 6 months. And she went and saw her physician, and her physician gave her an injection into her knee, which helped for a week or two, and then the pain was right back. And so she went back in to see her physician, and the physician's like, all right, here, what we're going to do is, she had prescribed an expensive knee brace, gave her this knee brace, and said that if this doesn't help, let's try rest, and if this brace doesn't help, then we'll think about another injection, and if the injection doesn't work, then we'll be looking at surgery. Didn't even once mention physical therapy. And this patient, props to her, because she's like, okay, well, should I be doing any physical therapy or anything? And the physician's like, no, just do some hip exercise at home and you'll be good. Like, I'm not making this up. Like, this is a legit story. I'm sure you've heard other patients tell you the same crazy story. And you're like, I can't believe this is actually happening. And maybe some of our listeners here can relate. Because yeah, it's super common. And anyways, props to this patient for, not taking that for verbatim, and decided to do her own research and find a physical therapist that could help her. And anyway, she found me online, and she reached out and told me her goals. And one of her goals was, well, first I asked her what her goals were, and she's like, yeah, I just want to get out of pain. And I'm like, okay, with what? And she's like, oh, if I can walk and maybe jog without pain, that'd be awesome. And I'm like, do you have any other ambitions? Like, do you want to run a marathon, half marathon, 5K, or anything like that? And she's like, well, I'd love to, but I've just been told that's impossible. And I'm like, well, if things weren't impossible, what would you like to get back to? And she's like, well, I had a triathlon scheduled, in 3 months. I'd love to be able to do that. And so anyway, she came in for PT, and within, I think it was like 2 or 3 sessions, she was out of pain. She was pain free. We had her back to running within a week. Granted, it wasn't like she was back to her regular mileage that she was before the knee injury, but we had her running at some distance. I think we were doing about 10 minutes of running, starting off really slow in that first week, but she was just ecstatic because she could run at some capacity, and her confidence started building from there. And she was able to do that triathlon pain-free without the brace. I think she got rid of that brace 2 weeks after working with me. And yeah, it's just crazy to see, patients and the kind of the crap that they have to go through just to get, decent help and get relief. And it's not, it wasn't anything it wasn't a crazy complicated case either. That's the thing that's so irritating, right? It was really simple. The thing is, with the way the medical system's set up now, is you go see your physician, you see them for 5 or 10 minutes, right? And what they do is they do an X-ray, and then if they don't find anything on an X-ray, which most of the time they don't, unless it's like a skeletal issue, but everything else that's not bone isn't going to show up on an X-ray. So guess what they do? When they don't find anything with an X-ray, now they order an expensive MRI. Now they see something that shows up on an MRI. All right, we're going to stick a needle in it and do an injection. If that doesn't work, then let's do surgery, right? And they really never take the time to figure out and listen to the patient. That's the same thing too with traditional PT is, you go see a physical therapist for 10 to 15 minutes, and then you're handed off to an aide or an assistant to do exercise, in my opinion, you could be doing at home, right? And 10 to 15 minutes is not enough time to really see how this patient moves, see what their strengths and weaknesses are, what they're having difficulty with. It's not enough time. The thing is, that's a great thing about, and why I started Pro Kinetix Physical Therapy and Performance, is to allow me to have that one-on-one hour time with a patient, because it allows me to get to the root cause of this and be able to correct it, right? Again, it wasn't a hard case. The reason that we were able to fix it is because we had that time and we have that one-on-one with patients. And yeah, it's just frustrating to see, what the medical system's like and kind of what patients have to go through. So.
Yeah, no, Ben, you bring up a really excellent point, and that's why actually, as a PT, I saw you at Pro Kinetix out and ended up wanting to work with us in Pro Kinetix, is because of that fact that we have gone out of network, which allows us to treat in the way that you were talking about. So I don't think it's necessarily the providers or the practitioner's fault, but as you were saying earlier, that's just the way the system's set up, right? There's just the way that insurance bills and the way that we have to have that flow of patients, that they only get that limited time with their patients. But by not going with insurance, by going out of that route, we get to kind of set up the appointment as we so see fit and what is the best benefit of the patient. So at Pro Kinetix, we get the advantage of having a whole hour session with you. You're going to be spending that whole hour with a PT. We don't bring on any aides, but it's that one-on-one time with the actual practitioner with you the entire hour. And typically too, with that limited time in the normal clinics, PT clinics are going to be seeing you maybe 2-3 times a week. And I don't know about you, but if I had to take time out of my week, my work week, my time with my family 2 to 3 times, that ends up kind of accumulating quite a bit of time and devotion that you have to spend just getting over to the clinic. So at Pro Kinetix, because we have that one-on-one time, that whole hour with you, we usually only see you 1 time a week and then give you exercises and progressions to be doing at home on your own. And because of, again, that more time and quality time with your provider, usually when you see in-network PT, it's going to be a total with that 2 to 3 week visit, 30 visits. So again, that's accumulating time. That's 20 to 30 hours that you've had to be going in and out of a clinic. And because we are seeing you 1 time a week, usually we're only seeing patients maybe 5-10 visits. So you're really also valuing your time and saving time by going out of network system. So, and I think one thing as strength and conditioning specialists as well, that we really focus on that fitness and wellness side. So we really take a whole body approach. And as Ben was alluding to earlier, it's like not just getting you out of pain, but we want to get you back to those things like running. We want to get back to you like my other client that was deadlifting. We're going to be the last people to ever tell you, oh, you hurt your knees from running, stop running. Your back hurts from deadlifting, stop deadlifting. I think with that quality time that we get with our patients, and again, with our focus on performance and our strength and conditioning background, we're able to and encourage our clients to always, of course, get back to those things they love rather than just avoiding them. So again, just being out of network has really been a game changer for us as clinicians, getting to treat the way we want, and also for our patients as well, not dictating what we can and cannot do in those sessions. Another frustrating thing with insurance and why providers in network are also limited to not maybe want to go deadlift with you or for sure get you back to running at full capacity is because insurances don't really care. They're more interested in making sure you can go to work, you can get up off the toilet, you can dress yourself. So they aren't necessarily interested in always reimbursing you for that kind of health and wellness and performance side of it. So we, with the way we have things set up, we're able to be more proactive. We're able to dip and kind of go that whole spectrum from initially just that acute rehab to all the way to getting you back to performance. So having worked at Pro Kinetix, I love that way. And I feel like, honestly, it's the way that physical therapy should be. And I think it's in the best interest of their patients. So it's, again, the main reasons that we ended up doing it and going out of network and making that choice.
Yeah. Yeah. And it's unfortunate like it's came to this point because, it's insurance dictates so much of what we cannot do. Like there's a lot of patients that I've worked with that have found us that they were actually kicked out of their other physical therapy clinic that they were going to, right? Like they're like, I'm like, okay, what are you looking for? Why do you think we're a good fit for you and whatnot? And how do you find us? And like, oh, well, I mean, the other physical therapy clinic that I was at, they insurance stopped reimbursing that physical therapy clinic because they said I was too high level, right? They were starting to get back into running, getting back into working out. Well, insurance company doesn't deem that as necessary, medically necessary. So when they don't deem it necessary anymore, they're going to stop reimbursing. The clinic, because they need to make a profit, they discharge that patient, right? And now this patient, because they discharge it because they're not making any money off the insurance company. And so now this patient's just in limbo land and they don't really know what to do. Like they want it, like, if you ask me, like, I don't know, I'd be lost if I couldn't work out and exercise and whatnot too. And it's so ridiculous that insurance companies are dictating what's, important to the patient. Right. And so that's where we kind of really pick up the patients too, that are kind of in this limbo land and be able to help them out as well. But yeah, it's sad that it's come to this point and whatnot too. But hopefully things will start changing down the road. But as of right now, I don't see it happening. And one other thing is a lot of times if you go in network route with clinics, the insurance company, if they come in with knee pain initially, and like let's say they were working out and they injured their shoulder or hurt their shoulder, you would have to get a script from a physician to say that, oh, it's okay for the physical therapist to look at that shoulder. It's like I've had it happen where the patient's like, yeah, I came in and I saw the other PT and I had knee pain, but then I also had shoulder pain. They're like, no, we can only look at the knee because the insurance states that that's all we can do and look at. I'm like, that's so ridiculous. And like, no wonder, like, the medical system is healthcare costs are just astronomical in this country. And a lot of it's due to the insurance company dictating what is best for the patient. An insurance company doesn't have any medical background. They didn't go to med school. They didn't go to, they get their doctorate of physical therapy. They didn't get this education. Why are they dictating, what we can and cannot do with patients? But I'm not going to go on a rant, but pretty passionate about this. And I mean, that's the whole reason I started Pro Kinetix, is to help people like this and whatnot too. So.
Yeah, no, I'm all with you, Ben. So I'm a big proponent of the way that we have the practice set up. And yeah, guys, so that was kind of what we wanted to discuss in this first episode. Again, we're going to be focusing on those 4 pillars of movement, nutrition, stress, and sleep. And we'll be bringing in experts in the Oakland community so that you guys can hear from their experience and expertise and hopefully provide you guys with useful tips around those topics. So we're really excited to see where this podcast goes, to get this information from those local experts out to you guys. And we just want to thank you again so much for listening to the podcast, and we'll catch you guys next time.
Thanks, guys.